Live!
Live! I am?
Yes.
Good to know.
Good to know. Here at Suzie Health Solutions.
Hi, Matt.
We're Suzilla. It's Suzie.
And Matt.
And Matt.
We are Suzilla.
We're at the Enrollment Center here in Wenatchee. Woot.
I don't know if you can see the sign.
They can see a little bit of it.
Well, it says Enrollment Center on the sign.
Okay. So what we're going to do is we had a request on, there's still some confusion out there about ARPA being able to put money into pockets.
ARPA, the American Rescue Plan Act.
Yes.
Okay.
And that's largely because we talk so much about healthcare. Mm-hmm. Sometimes people get lost.
Yes, and it's a lot.
It is a lot.
And we talk a lot, and we have a tendency to jump around.
So we're gonna try to stay on track and provide kind of a set, kind of show how someone could simply put money into, well, Main Street.
Okay.
And that's the big focus today.
Okay.
So the first one is, right off the bat, how do we stimulate the economy? Is right here. Pay your taxes.
Yeah, because the taxes go to support your infrastructure.
Well, it's
among other things.
More than that. This year it is, all the problems that have stemmed from the stimulus checks of people not getting them is because people not paying their taxes.
All of them?
A large majority.
Okay, not all of them, but a lot of them.
And here's
because for some reason you didn't make a lot, so you didn't have to file taxes, so you didn't file taxes.
Stop.
Okay.
with that logic.
All right.
That's the logic that has gotten us here, and it won't get us out.
Okay.
So
I'm just saying what might have happened.
Yeah, everyone can excuse away why they didn't file it. Always file your taxes. Mm-hmm. Period.
Even if you don't make enough money that you're required to, file your taxes anyway.
And here's the thing. With your tax filing this year, if you've got kids, come July 15th, what do you get?
You get the child tax credit directly deposited to your account in $250 increments.
So yeah, there is another step in on reasons why you always file your taxes. I cannot stress that enough. And the other thing about filing your taxes, and this is something that we really advocate on, always use your experts.
Use an expert, and even if he doesn't have his grammar correct. An expert, yes.
Use a expert.
Use an expert. Use someone like us.
We don't do taxes, but we got people who do.
Right.
The reason why I say this is this year was a great example. We strolled into our tax person. We had all our little receipts in hand for write-offs, and he turned around and found us another one.
Yep. Stuff that it was part of the stimulus packages. We had no clue it was there. He's an expert. He did. We ended up getting a little bit of a refund versus having to pay taxes.
Yeah, because we pay some into taxes, and
we expect to pay taxes. Yeah, so it was a nice surprise. It
was a pleasant surprise, but that's why I always say use an expert, because we're doing the 1040 form and we're writing things off. That's an actual tax write-off the following year.
Yes.
So it literally costs us nothing to use an expert.
That's true. We can write off the tax preparation fee.
So that's why I tell people always just grab an expert. You write it off the following year. It costs you nothing out of pocket. It's just a little shuffle game. And here's the thing. That's one less person in the local economy that needs a job.
It's true. That's a good way to put it.
You are actively stimulating the economy.
You are supporting a small business person or somebody who works in the community.
Now, which brings us to healthcare. Okay, some big things have happened this last weekend. We actually reached 31 million people enrolled in Affordable Care Act.
That's great.
That is the largest number ever.
Yes.
And that's the largest number without anyone requiring you to sign up.
That's true, but there's no penalty if you don't have health insurance anymore.
That penalty's been gone for several years now.
Right, and the only drawback to not having health insurance is you don't have health insurance.
Well, yeah, and we're gonna really talk about that because the Affordable Care Act literally cut the uninsured rate in Washington in half. We're one of 7 states that did it because we kind of got our act together here. We went from 14% down to 6.6 in last December.
That's great.
So this does not include the Biden special enrollment for COVID.
No.
So we are...
Which has kept people getting... Yeah, that hasn't stopped the enrollments at all.
Yes, and this kind of brings us to the next expert. And this is in our state. Always use an expert. All right. If you have health insurance, you want someone attached to it. And with a Affordable Care Act plan, you can have a navigator and a broker.
Correct. You can double down on your customer service.
You can double down on your customer service, and this is the reason why. First of all, navigators, they get paid by how many people they service.
Yes.
That's their contracts. So by having them attached, you're building a nonprofit network. Our current ones run out of Confluence Health. We do a lot of work up north with Room 1.
Yes. Thank you, Room 1.
So that is, if you've got a health, it's like, yeah, I can do it myself, and there's no money going back into the economy.
True.
And it's money that your taxes already take care of because you're paid your taxes. So it's nothing out of pocket. And as Susie pointed out, you're doubling down on customer service.
And you're not going to get charged a fee if you use an enrollment center or to find your broker, or if you use a navigator, they're not going to charge you for it.
Correct. If they charge you, if they say, "Oh, I got to charge you," walk out the door, fire them. They're easy to do. There's 11 enrollment centers across the state. We happen to be in Wenatchee, cover most of Central Washington.
Exactly. There's no restriction. A broker can charge a broker fee. There's nothing stopping them from it.
There's 2 ways we get paid. One is a commission straight from the insurance company. The second is if we charge fees.
Right.
Both are legal in Washington State.
Yep.
We chose a long, long time ago not to charge fees.
Right. We did that intentionally because we knew that the people who needed the health insurance the worst are probably the ones who couldn't afford a $250 fee.
Yeah.
Yeah.
And to be quite frank, we don't get paid for a bunch of the stuff we do.
Oh, absolutely. But we're okay with that.
Yeah. For example, we don't get paid for Apple Health.
Nope.
However, having someone attached when you're at Apple Health is incredibly useful because we can sit there and sort out problems.
Exactly.
And by already having us attached, we're one step ahead of the game. We had we've had 2 big problems last week.
Yeah.
Client made their payment. Because of the big changes that happened May 6th, that payment was not was accepted by the insurance company. They took the funds, but they didn't apply it to the account.
Right.
And she's like, "Well, what happened here? Why aren't they giving me my cards?" So we had to call them up, talk to the customer service, and they turned around and said, "Oh yeah, there's something definitely wrong with this account." It took us 10 minutes to sort it out.
We have connections that maybe you don't. Yeah. And we've got access to we've got all kinds of little tricks up our sleeves.
Yeah, we see hundreds of accounts. The other one was the insurance company they've said that they were supposed to term the policy back in March.
Yeah.
And they did not.
Yeah.
And we were able to jump through the flaming hoops of fire and then get them restarted with a June 1st start date.
Correct.
And that was only because we were connected with them and we were able to see what was going on and set up. And additionally, we helped helped them file a complaint with the Office of the Insurance Commissioner.
Correct. And then the Office of the Insurance Commissioner enabled us and the client to get this resolved in a manner that was acceptable to our client.
Now, if you're out there without health insurance and you haven't shopped, May 6th, this is the day. May 6th. Everything changed again in health insurance.
It did.
So if you're on Medicare or a large group plan, all you have to do pretty much is keep doing what you're doing. Shop. If you're on Medicare, you should have an agent attached to that. And that's strictly because if you're attached to a local agent, they can help you. They can answer questions. Not only that, you're putting money directly into the economy.
Correct.
If you're in a large group plan, you're kind of stuck with what the company's getting at.
Yeah, and hopefully you've got a good plan with a good company.
Now, if you're on the individual side, this is if you don't have a policy, this is the time to shop.
It is.
We have until August 15th.
That's correct.
So you want to share this as much as you want. It's like, look, we have, Susie's got the record for saving people. This is the use an expert.
Yep.
How much did you save one family a month?
$1,400 a month.
So that is the example. We was like, look, this is, a tremendous savings out there. It's a radical change. We were seeing people come in that have had unemployment this year. Do you want to talk about that?
Oh, well, we've had a lot of people. Well, the unemployment kicker with ARPA, the American Rescue Plan, is if you have drawn unemployment for even 1 week in 2021, you get you get an extra special perk. And this extra special perk is you get full tax credits. It doesn't matter what your income is, you are going to get the maximum amount of tax credits available. Yep. And with that maximum amount of tax credits also comes the maximum amount of cost sharing. Cost sharing being where the insurance company kicks in and reduces your out-of-pocket expenses. And the American Rescue Plan made it so anybody who drew unemployment because of COVID, well, pretty much for any reason, but COVID's this big motivator there, in 2021 gets all those extra perks. And now that's going to end in
December 31st.
But for the latter half of 2021, you can have a silver plan with platinum benefits for probably less than $10 a month. Yeah.
And so we've been kind of telling people it's down to the small group level. If you let your team, go for unemployment, if you haven't priced since May 6th, you need to shop your plans.
Yes, it might be a great opportunity to maybe break up your small group plan and go a different angle.
Yes. And we mean that because we want all the small businesses to have maximum dollars in their pockets.
Yes. And this is one way they can actually help with that.
Yep. Because here's the thing. If someone says, oh, hey, I'm going to hire someone, and they say, oh, yeah, you've got benefits that start in 60 days, it gets rid of all those tax credits for that awesome plan.
Yeah.
So you're basically taking away health care in the thought of providing a perk.
Yeah. So that's why it's not a bad move to reassess. And now, large groups, that's a whole different conversation. A small group, a lot of times the premiums are higher because it's a smaller pool. Yeah,
we've been typically pricing small groups, and 9 times out of 10 before the American Rescue Plan, the individual plans beat them out.
Right.
And price.
Another thing that can be really valuable is if you've got a small group and you're saying, okay, here, everyone shop on the exchange, they can pick a plan that suits their needs better. Instead of getting one plan and trying to squish square pegs into round holes.
Mhm.
Everyone gets their own square hole.
Yeah, there's no COBRA to deal with because they're on their own plan.
Mm-hmm.
So if they leave the company,
They take it with them.
they take it with them.
And if you've been using payroll deductions to help subsidize their premiums,
Yeah, you just give them a stipend.
yeah, give them a stipend saying, and you can suggest, hey, I highly suggest this extra $200 goes towards your life insurance or your health insurance premium. As long as they send it through payroll and go through the taxing process, that's perfectly kosher.
Mm-hmm.
And you're helping them, they're helping themselves. And if they choose to leave you, they can take their policy with them. They're just going to pick up that extra $200 on their side, which is a heck of a lot less than the $1,700 they probably would have been paying for a COBRA plan.
Which brings us to why people have health insurance.
Right. Why do people have health insurance, Matt?
Because, well, there's some people that use it immediately.
Yes.
And then there's some that are going to maybe use it.
Right. It's not about what's happening now necessarily. It's what could happen.
And if you don't have something in play, well, the hospital's got to bill somebody.
Yep.
So, we've got Confluence down the street. Big, nice, shiny building. They're always adding new things. That costs money, so they charge.
Right.
We're actually, by the state numbers, we're the most expensive, if not the second most expensive in the entire state.
Right. We have a near monopoly with healthcare, and we have a spread out, relatively smallish population versus, say, the Seattle area, which has a half a dozen different providers and a much more dense population. It creates a dynamic that drives up rates because of negotiations.
Yes.
Back to the takes two to tango.
Takes two to tango. So yeah, you always want to have coverage before a problem happens.
Right.
We've been blessed. We've had several people have were at bronze plans before May 6th. They said, "Oh my gosh, medical disaster 5 hit,
and it was a doozy.
Can I change plan?" And because of their tax credit changes, we were allowed to get them changed.
This is not something we can do in a normal situation. Yes. This is specific to this COVID Crisis Act.
Yep. And we've only got until August 15th to do it.
Now, I had one just today. One of my clients, it's a married couple. One of them went from bronze to silver because it was a really good move. Moved the other partner from gold to silver because of the increased cost sharing. It actually was a better plan. He was a solid gold plan. There was nothing wrong with it. And for the situation they were in, if this hadn't happened, it would have been perfect for what they needed. Yeah. A little bit on the expensive side, but good for their situation. Moved the partner to the silver plan. Suddenly their deductible dropped. They're out to negligible because of the extended cost sharing. The out-of-pocket maximum dropped by about $3,000. Yeah. And the surgery they have planned, and they have had planned the entire year, they're going to save thousands of dollars on that surgery.
So it literally puts money that they've already set aside back into their pockets.
That's correct.
That they can spend locally on business.
And they're going to be saving about $400 a month on their health insurance.
Yeah. And that's one of those tricky things where experts come in to play, always use an expert.
Use an expert.
Seriously.
You should just put up a big poster.
I should. From the very first year we encountered that of people selecting gold because it's gold.
Yeah.
Where silver was a better plan because of the cost sharing.
Right. Cost sharing is it's an interesting little, I lost the word. It's a little perk that can totally change a plan.
Absolutely.
And it's income based with the affordable care, not the affordable care, but the rescue plan. It's totally changed up because of the unemployment thing. Yeah. But it's there, and use it.
Yeah.
You know,
and the big thing out there is we're seeing the folks with the health shares, or they've got some of these weird catastrophic plans that they've been trying to limp by.
Yeah.
And they're doing it because they're high income earners.
Yeah, and they're not getting breaks otherwise.
And they're not getting breaks. That changed with the American Rescue Plan. The most you'll pay is 8.5% of your income.
Which is a huge difference from if you're making over 400% of the federal poverty level, forget it, you just don't get any credits.
Yeah, it was about $54,000 a year for a single person.
Which is still a pretty good dollar amount, but when you're talking about a move from $900 to $600, it's a difference.
Oh yeah, it's a tremendous difference, and we've seen they said the average savings per state is $70, but it's looking more like $100 plus.
It is at least in our area.
Yeah,
we're seeing some definitely different numbers, especially for the people who basically were pulled back from the financial cliff.
Well, what it is that benchmark plan, the silver, the second lowest silver price.
Yeah.
Because it's set higher, means we get more tax credits.
Exactly. So I guess that's one of the advantages of us having those higher rates.
Correct.
Yeah. That's
so. Yeah.
It all balances out.
The lesson to this is, first of all,
always first and foremost,
always pay your taxes. Use an expert.
Yes.
To pay your taxes and
let us help you.
If you haven't shopped for health insurance since May 6th,
call us. Come see us.
Use an expert.
Yes.
Because there are so many different rules, things change.
That's right.
And we want you to have the most money in your pocket as possible.
And the most effective policy to help you for your health insurance.
And let's leave on a positive note. The more money that is in our local economies, the stronger they are, the more storefronts get filled up with small businesses.
If you've got an extra $40 a month, you might buy that piece. You might buy that cup of coffee. You might save some extra money for your kids' education. You might decide to take your better half out for a dinner some night. Things like that stimulate the local economy.
And that is incredibly important.
It is.
To be able to go out there and shop. So, hey, everyone, have a great rest of the week.
Yep, it's Tuesday, last week of school for a lot of the kids, and they're going to be a little twitchy for a few days.
Yep, so hey, have fun, everyone. We will talk to you soon here at Suzilla.
Bye.
Bye.